Hey, what's up, peeps? You're listening to the Let Loose with Lou podcast. I'm a full time working woman, mother of three, and a wifey to one lucky man. My passion is getting to know people, listening to their stories, and learning from their points of view on life. Thank you so much for listening, and I hope you enjoy it. Hi, everyone. This is Lou with Let Loose with Lou. Welcome, welcome. And you guys probably won't see this till the following week, but it is Veterans. So I would like to give all the veterans a shout out. Thank you all so much for your service. Today is going to be a very nice day because I have Dr. Christine Petti. Welcome, Dr. Christine Petti.
Thank you so much for having me.
Dr. Christine Petti is a board certified plastic surgeon specializing in cosmetic surgery. Thank you very much for being here. It means a lot. So, my reason for having her here is that I had surgery with her, and I contemplated about this for so long because I wanted one to make the right decision. Now that I've had made it, I am like the happiest person. But my thing is that it wasn't so much for cosmetic. It was more because, as you know, because we had this conversation, I couldn't see from the sides of my eyes. So, would you mind explain a little bit of the surgery that I had?
I'd love to. So, what you had was a procedure called blepharoplasty, which blepharo means eyelid in
Eyelids.
Greek,
Yes.
and then plasty means everybody thinks it's like plastic, but it's not. Like it means to change the shape or the form of something. So,
Ooh.
plastic surgery
Yes.
is changing the shape and form.
Oh.
So, what you had were symptoms related to excess skin.
Mhm.
And also, there's fat around the eyelids too. That's
Yes.
normal. They're kind of like shock absorbers that keep the globe, immobilized in the orbit. And so, when we mature, we
Mhm.
never say the O word or the A word. Those are bad words. But
No, we
when
don't
we,
want
yeah,
that.
as we mature and become wiser and
Yes.
more experienced, what happens to our skin is it relaxes and then it allows the fat pads to kind of move forward
Mhm.
because there's extra space.
Yes.
So it presents as what we call, like, commonly you call them bags.
Yes.
But also that is weighing down. Don't forget your eyelid you're using constantly, right?
Yes, all
Open,
the
close.
time
Yeah.
for everything. We're blinking and
Yes.
trying to look left,
And
right.
we use it for expression.
Mhm.
And so patients will come in and say their eyelids are very heavy, they're fatigued, at the end, especially at the end of the day.
Yes.
And then that skin kind of hangs there. It
Mhm.
interferes with vision, but also it kind of makes you look just forlorn,
Tired.
tired, heavy.
Yes.
Yeah.
And so with me, I I started actually with a little bit of Botox on the corners to kind of lift it because when I was driving, I noticed that it was hard for me to see, especially at night.
You were using your eyebrows a lot.
Yes, and
Yes.
so I was lifting them to try to
Right.
yes, but it after a while, your head hurts, your vision strains.
Right.
S
You get
Yes.
headaches and then lines.
Yes, yes, yes. So a friend of mine had did her eyelids, and I was like, "Oh my god, they look so good. Do you see a difference or do you feel a difference?" And she said, "Of course." She goes, "Especially when I'm, driving." I said, "Well, that's the problem that I have, especially at night. It's the worst. You can't see." So, that's when I went to you and I was just like, "Oh, I fell in love." I was like, "Okay, she knows what she's doing. She has the experience. Let's get this done." Like, I was
And I
excited.
had the surgery myself.
Yes, you
So,
you did
yeah, and
mention
I
that.
I did tell you that, yeah,
Yes.
how some of my professors,
Mhm.
when I went to a meeting and I was in my mid-40s, they said, "Oh, Chris, you're" I was in Chicago, and they're
Yes.
like, "You're in Hollywood." They think
Yes.
every LA is
LA's
Hollywood.
Hollywood.
They said, "You look like, your eyes are kinda heavy, like, you need to have your eyelids done." I went, "What?" I had just had 2 children,
Yes.
and so, anyway, it was the best thing I ever
Yes.
did. And just exactly like you said,
Mhm.
I was working really hard to see, and I was like, "Oh my gosh, I should have done this long time ago."
And I noticed for me, it hit right about maybe about 50. I started
Mhm.
to feel it. And I think that I think that a lot of people that feel that there isn't an alternative, there really is. Because for me, I thought there wasn't until I did my research and I spoke to my friend. And then I was like, oh, wait a minute. There's actually something I can do. Let me go and,
It
learn a little more and do my
it's
homework.
a very straightforward surgery as well, which
Mhm.
is really nice because it involves removal of skin
Mhm.
and then also contouring the fat. And so I always consider it a really nice introduction to cosmetic surgery because
Yes.
it's a limited area, it's a pretty quick recovery. The scar is right in the natural crease of
Crease.
the eyelid.
Yes.
And again, you want to make sure that you take out just enough so that it looks beautiful like your eyelids
Natural.
do.
I know. I
And then
love
it
my
hides the
eyelids.
scar, and the scar gets better with time, you know?
Absolutely. Like
Yeah,
with
and isn't
everything.
it great because you can go shopping and get a lot of new makeup that you could never wear.
I
I know
wasn't able to
one of the
wear.
things is that I remember I put my eyeliner
Mhm.
on, and it would be, like, up here because the skin was, like, to
And
the eyeliner. I'm like,
or the
"Ah."
mascara.
Yeah.
And you're walking in somewhere and you're like all happy and then they're like and you're like, "What's going on?" And
Yeah,
you're like,
you need
"Oh
a
my
little touch up.
god, yes." Yes, that used to drive me crazy. I never wore makeup.
Yeah.
Um,
Well,
s
you're lucky in a way, and I think I talked to you about this, but you have gorgeous brows. But
Thank
when we
you.
look at the upper eyelid, I
Mhm,
also look at the brow
mhm,
because a lot of individuals will have, now, me, when
mhm.
I had my upper eyelids done, I had my brows done because I wear a lot of equipment on my head. I mean, I
Yes.
wear all
Oh,
of these
yes.
lights and, I
Yes.
wear loops, very
Yes.
heavy, like magnifying lenses. And so all that I think weighs down, but some people are just born with brows that are, yours are
Yes.
gorgeous and
Oh,
really
thank
high,
you.
so you have a lot of space. But it's really the it's like the distance between the corner of the eye and the lateral brow.
Mhm.
That's a very important area for beauty. Like you want to have this as
That's
wide as
wide.
open as
And I
possible.
love that. It's like I
Yeah.
feel like my eyes look brighter. And I
Yes.
love that because for a while I was just like, "What's happening?" I look tired. Like, not only do I feel tired, but now I'm looking tired. I was like,
Right.
"Oh my goodness." So, what's the age that you start to really see this in people?
Well, definitely
Mhm,
in the 40s to
mhm,
50s is when it starts, but there
mhm,
are some I have done some in the 30s,
mhm.
because it's like hereditary.
Yes.
Some people just have the fat there
Yes.
actually,
Oh,
and it can be
interesting.
the lower eyelids
Yes.
too. I've done some women that are like models that
Mhm.
were in their like early 30s where they had
Wow.
the bags underneath, and I just
Oh.
when I do the lower lids, I go from inside.
Yes.
So today I
Yes.
did lids today. Isn't that amazing
Yes, it
that I'm
is.
here?
Yes, I
Yeah. So
love
I
that.
did the brow, I
Mhm,
did the upper and the lower, but the lower eyelids, sometimes the skin is
mhm.
beautiful, but there's puffiness,
Yes.
especially in a younger person. So
Yes.
just to actually be able to recontour that
Mhm.
so it's smooth again
Yes.
is important. And I go through that. Yeah, that's what I was gonna say. I go through I don't make an external
Mhm.
scar. So it's kind of a external scarless
Yes.
lower eyelid lift.
Mhm.
And you did not have that. I did.
Yes. Oh,
So
okay.
yeah, when
Yes.
I had the lowers done
Mhm.
too. So again, it was great. I would never want to have a scar underneath my lash line because sometimes you can see it.
Yes.
Or when you get
Mhm.
older and the skin gets loose, it kind of pulls
Oh.
down,
Mhm.
and then sometimes it rounds the corner of the eye.
Yes.
So you can kind of, I mean, the eye is
Mhm.
supposed to come to a point, like,
Yes.
beautiful.
Yes.
We call it the canthus.
Yes.
So there's an inner canthus and an outer canthus. And so those are very beautiful landmarks that we want to preserve. So
Yes.
when you make the external scar, it can alter that.
Yes.
So when you go internal,
Mhm.
you don't.
Yes.
So yeah, that's very, very important.
It is important. Do you see that there's more women than men or men than women that
Well, I do see more women than men, but I do have the women bringing their men in.
Oh, that's interesting.
Yeah, like,
Okay, yes.
after sometimes,
Uh-huh.
the woman will go first,
Yes.
but then they'll talk to their husbands or their significant
Yes.
others or their friends and say, "You should see her." And I've done I've like redone eyelids. Sometimes
Oh.
men will
Mhm.
go and commonly they'll go maybe to another specialist. I don't want to
Mhm.
say who, but sometimes
Yes.
they just take the skin
Yes.
out.
Yes.
They're not taking like contouring it
Yes.
like you would for aesthetics.
Yes.
And so men
Mhm.
tend to have very heavy skin and
Mhm.
really heavy
It's
brows.
probably tough, huh?
So they get
Yes.
crowding. So sometimes like the upper eyelid will look crowded and it looks like there's a lot of skin there, but it's not. It's just that the
Mm.
brows need to be repositioned.
Oh,
So
got it.
sometimes you'll go in and
Yes.
not even do the upper eyelid, but
Mhm.
do the brows
Repositioning.
through the upper eyelid. So yeah, it's
Oh.
called a brow pexy and it's really works well in men and women,
Oh,
but
okay.
it's common in men.
That is so interesting. I
Yeah,
love to hear all the stories because to me, the more you know, the more, the more you learn, the more you know.
I love to have educated patients.
Too. I
Love that.
love that. And that's why I wanted to bring you in because a lot of people ask me like, how what did you think? How did you like? I said, "Oh my God, I love her." Like I feel like it opened up so much for me because for so long, like I said, injecting the Botox just to kind of lift it up, and it wears out and I mean it's
Well, that's not
okay.
gonna shrink your skin, but let me just also mention
Yes.
that you did not have to have this, additional
Mhm.
procedure, which is laser. I do a lot of the laser surfacing
Yes.
also at the time
Yes.
of the eyelid lift. Now,
Yes.
because I think of it this way. Okay, when I take that extra skin out and I
Mhm.
contour the fat so it's
Mhm.
not bulging
Yes.
anymore, whether it's the upper and then the lower, I don't take skin out, but I just take the contour the fat, then you're left with the old skin.
Yes.
Like, I mean, people don't see what's removed, they see what
Correct.
remains. So
Yes.
you want to definitely
Mhm.
polish that skin.
Mhm.
And so I do use the fractional CO2 laser
Which
surfacing.
I really wanna try. That's
Yeah.
gonna be my
And
next.
that's good.
Yes.
So we have wrinkles that are static wrinkles, meaning
Mhm.
like they're just there and you see them, right? But then you have the dynamic wrinkles, which you're
Yes.
talking about, like the ones that Botox works
The
on. So when you
crows.
smile, yeah, the crow's
Yes.
feet.
That's what I have.
But it's nice to kinda soften
Mhm.
the skin and to polish it at the
Yes.
end. I
And
love that.
I love that too. I do wanna do that. I was thinking maybe in the fall, just to kinda give me a little bit of resurfing, like a little
Yeah.
polish of the skin.
Your skin is beautiful.
Oh, thank you. I work on it hard,
Me
though. I have
too. It's
to.
a
Yes,
job.
it is a job. It's so hard to maintain. Why is it that us women, the older we get, the more we have to maintain, but
Definitely.
men, it's like the older they get, the refiner they are. It's
Yeah.
so unfair, right?
Their skin is thicker,
Oh,
heavier, a little bit more
it's
collagen. I
still
don't know.
not fair.
I'm coming back as a man.
Yes, what I said. I'm like, I'm coming back as a
I'm not
man.
doing this
No,
again.
I'm
It's
not
like, oh my
either.
gosh. But I always say another thing I say, Mary Lou, is like every birthday,
Yes.
there's like another jar. There's another serum next to my counter. And it's
Oh
like
my
line them up,
god.
right?
Line them up.
Oh,
I know, that's how I
yeah.
feel.
But
Ev
it's worth it. I want to look good.
Oh, yes, and that's why I made the decision because I was like, "I gotta look good for another 20, 30 years, not only see, but look good as well?"
Right.
And so, yeah, I'm really happy. I'm so happy with this. I tell everybody, I'm like, "Oh my god, you guys gotta you gotta go and see her, like, she's the best." Like,
Well, what about the recovery? Like, but tell them
so
about that. So,
okay, so the
yeah.
recovery was
She was
actually
fun to
very.
take you were fun to take care of.
That was funny, Bill. Okay, so I did it literally under, right? I was,
Yeah, she was actually done because we just did her uppers.
yes,
I can do the brows and the uppers. The brow I do through the up
locally.
yeah, under local. So
Yes,
she was awake and, we just gave her a little bit something to relax her orally,
yes.
and she did really well. But I mean, a lot of times it's trust,
Yes,
right? It's
absolutely.
trust.
And with all the research that I did, I knew that you were just the perfect person for this. And
And my staff. I
yeah,
have,
oh
like,
my God,
fantastic staff.
you really do have a
I do.
fantastic, yes, they're all caring, they're
Yeah.
diligent about,
They make you
yes, they
relaxed.
do.
Yeah.
So we know getting ready for surgery and I'm laying there and she's like literally opening my eyelids, right? And I'm talking, we're singing
Yeah,
songs
we
and
had the music.
oh my God,
Yeah,
it
it was
was fun.
nice.
But I went home and I was fine. I
Yeah.
didn't have any pain. The discomfort was very minimal, like so minimal.
And eyelids,
Mhm.
it's more the swelling a
Mhm.
little bit and then the bruising. Now, when I do it under local, sometimes I do have to give more of the local
Yes.
anesthetic, which is an injection.
Yes.
But I mean, you numb up, right? You numb up
Absolutely. Yeah,
fast.
fast.
But then when I do the
Mhm.
dissection, I have to have a little bit more there because
Mhm.
I don't want to have bleeding at all.
Yes.
And I can see everything beautifully.
I'm just really excited because eh, those you did such a great job.
Oh, thank
And
you.
I think the recovery for me was probably about a week and a half, right? Because I took pictures every single day, and, like, by the 4th, 5th day, you couldn't tell, like,
Right.
besides just a little bit of bruising on the corners right here, that was it.
Yeah, we didn't do your lower eyelids,
No.
but, the bruising kinda settles down to the
Mhm.
next level, and then remember you did have the sutures, so the way I sew it up,
Yes.
most of the sutures are internal and there's like a pull out,
Yes.
but we took those out at about, I think, anywhere from, 6 or 7
I
days. It was
think
like
it
about a
was.
week.
Yes, it was
Yeah, it was
about a week, but
yeah.
it was great. I was very happy. And what other services do you have there at the office, Dr. Petty? Because
Well, I have everything really from head to toe.
yes.
And we have both surgical. I
Mhm.
love, of course, I'm a surgeon. I love to be in the operating room. That's my favorite place to be. But there's a
Mhm.
lot of things non surgically that enhance the
Yes.
results of surgery, or not everybody's ready,
Yes.
you know?
Yeah.
So, what I do is, as far as starting from the head,
Mhm.
I do facelifts, I do neck
Mhm.
lifts, eyelid lifts,
Wow.
upper and lower, the brows,
Yes.
rhinoplasty,
Oh.
everything with, well, with the face,
Yes.
the neck. If you don't need the base or neck lift, you
Mhm.
may just have a little heaviness of
Yes.
the fat in the a
Yes.
double chin.
So what would
So,
you recommend for a double chin? What would you
well, it
recommend?
depends. I have
Mhm.
to look at this. I have to look at the skin. But
Mhm.
if the skin's like pretty thick and it can
Mhm.
redrape,
Mhm.
you can just do liposuction. You can also do if you're not ready for surgery or
Mhm.
perhaps can't afford surgery.
Mhm.
Kybella is
Mm.
deoxycholic acid. You
Mhm.
can do injections just
Mhm.
for
Refirming or dissolving?
it dissolves the
Oh,
fat.
okay.
Yeah.
There you go.
Yeah. And then
Because in
also,
women, that's what we tend to also
yeah.
see.
And then sometimes just firming the skin up will help. So the
Mm.
CO2 laser resurfacing, microneedling, those are all things that can be
Thank
used on the face.
So with the microneedling, how many sessions would you recommend?
I think a minimum of 3 is
Minimum
good
of
to
3.
yeah, good
With the
to start out.
CO2.
And then the
Mhm.
CO2 the same.
Mhm.
But I have a CO2 that's a really has like a no downtime CO2.
Oh.
Yeah, because the
Mm.
old one, people
Mhm.
it gave, bad name because patients had a lot of edema, a lot of swelling,
Yes.
and downtime. This one
Yes.
is like a no downtime.
Oh,
Yeah,
and it
it's
firms.
great. Yeah,
You don't have to go
I
buy
did
'em.
a couple of women that I know pretty well. Like I did their CO2 face, neck, chest. They're kind of
Mhm.
they grew up in Southern California, played tennis. They're pretty sun
Yes.
damaged, so they come
Oh,
in
yes,
like
yes.
twice a year usually for
Oh,
it.
okay.
Yeah, and we're trying to push back.
Yes.
And then they'll come in like maybe 2 or 3 weeks later. I give them their fillers, their Botox. They're ready for the
Yes, the
holidays.
holidays, they're
Yeah.
refreshed.
So that's like
Mhm.
non-surgical, but then I do a lot of body.
Yes.
So I
Yes.
do, of course, I do a lot of breast. I
Yes.
do a lot of redo breasts. So
Ooh.
yeah, I do sometimes 4, 5, 6, 7 hour breasts because some
Wow.
women have had a lot of
Mhm.
problems with them ruptured. They
Yes.
may be asymmetrical, like
Mhm.
different sizes, different
Correct.
position of the implant,
Mhm.
hardening,
Oh,
rupture,
yes, there's a
all
lot.
those.
That scares
Yes.
me. I'm
And
like,
then sometimes they're just out to the
mhm.
side, and we
Oh,
always want to have petty cleavage. I call it.
yes,
So,
the petty.
yeah. So you want to
That's cute.
definitely, what I try to do is make an internal bra and put the implants on top of the chest, not to the side or up or down. And then that requires a lot of internal suture techniques
Mhm.
that are really, really fun but difficult.
And, like, one of the things that, intrigued me and I why I felt confident with you is because being a woman, you kinda understand the
For
woman.
sure. For sure. I wanna
Like
have the surgeries as well myself because
yes.
those, pregnancy and
Oh,
middle age, all those things, I'm part of it happens to me too. So I
and
believe in what I do.
and exactly, and you only know what you feel, what you like, and how I'm gonna feel, right? I always go back to this when I was, when I was pregnant with my daughter, my first daughter, my OBYGN was a male, and he was so, like, so mean, like, he didn't like
We don't want to male bash, but
no, 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 no male bashing,
we love
but
men.
yes, we love men, yes, we do,
Yeah.
but, I mean, he didn't like, I was like, "Well, how can I explain this?" Like, I would have pains, and he says, "Oh, you're fine." And I'm like, "But no, but it hurts, right?" "No, no, no, you're okay." And "But you don't understand because you don't carry the baby." And so I was like, after my daughter, I looked for a female because, she bearing kids will know the pains, right? She knows what I'm
For sure.
speaking. Yes.
Yeah.
So, but some male doctors are great for some things and not for other stuff. Yeah.
Yeah. I know there's a lot of
Yes.
good male doctors too.
There's
I think
great.
to be a good doctor, though, in
Yes.
general, whether no matter what your gender is
Yes.
that you just listen. You
Yes.
want to
Yes.
listen.
And that's another thing, like when with my daughter's doctor, he wasn't listening to me and I
Yeah,
just
I
like
could tell.
yes, yes. But I mean, that's why thank God we have choices who to go to. And I was so
Right.
happy when I made my choice with you.
Well, thank you.
And out
My
of
pleasure.
curiosity, what got you into this
Yeah.
like
It's a good question.
mhm,
It's a little bit of a long story, but let's just make it short. The short story is that I was actually in general surgery training
mhm.
and I didn't really know like what area of general surgery because that's what we did. We used
Yes.
to go general surgery first and
Mhm.
then you picked a specialty.
Oh, okay.
Yeah, now my daughter is in plastic surgery at USC.
Oh,
And so
nice.
they now have a plastic surgery. It's a track,
Mhm.
they call it integrated.
Yes.
So they go right into plastic surgery and then
Oh,
they get specialty. We were general surgery.
yes.
I walked into an operating room where they were doing a breast reconstruction.
Mhm.
And I, as a general surgeon, I had seen breasts taken off.
Mhm.
And that was just, I mean, that's like an amputation. And when
Mhm.
you're a woman and you see that, it hurts.
Mm.
When you think about a woman
Mhm.
waking up without a breast and an empty,
Yes.
flat chest that's scarred
Mm.
and deformed.
Mhm.
So I was at the University of California, San Diego, and so my professor said, "Why don't you stay in here? Because the plastic team is going to come in and they're going to do a breast reconstruction." So they did a flap
Mhm.
where they took the abdominal tissue
Mhm.
and then they brought it up onto the
Oh,
chest and
interesting.
they made a breast of the patient's own tissue and she got like a tummy tuck
Yes,
and
yes.
then had the breast made of her own tissue
Oh,
without an implant. And I was just blown away. I thought, I
wow.
want to be on this side. I want to
Yes.
be creating
Yes,
something and
yes,
restoring. So
yes.
that whole like
Mhm.
preservation, restoration was just
Mhm.
I don't know, it just grabbed me.
It intrigued you, and you're fantastic at what you do. I mean,
Well,
you're amazing. I'm
thank you.
happy, and I know that the
I work
friends
at it a lot. I
yes,
work at it a lot.
it
You
is
can't take it for granted.
no, you cannot.
And if a patient gives you a compliment,
Mhm,
what I have to say is, it's really nice for you to give me a compliment, but
mhm.
I have to earn it with you. Like
Yes,
each person is
yes, yes.
new and you have to be 100% plus for them.
What's your favorite surgery? What do you like the most? Like
I really like
mhm,
breast surgery,
mhm,
liposuction, facelifts. I mean, I
mhm.
think they're very challenging.
Okay.
Liposuction is kind of fun. A lot of plastic surgeons
Mhm.
I don't think they like it as much because it's just kind of,
Yes.
but what's great about it for me
Mhm,
is that you make these tiny little incisions and these
mhm,
cannulas can get everywhere. I mean,
mhm.
they can get all these places. And
Yes.
so you can literally, it's kind of like Michelangelo or Leonardo da Vinci. I mean, you can like sculpt somebody's
Oh,
body and you
beautiful.
see it change in like a couple, 2 to 3 to 4, depending on what you're doing. But
Yes.
like arms, I
Mhm.
mean, incision here, incision here, removing, the
The
fat
flap.
that's been,
Yes,
yeah, the
yes.
bat, like a bat wing flap. And then also like, the tummy,
Mhm.
that tummy fat that just sticks there.
Oh,
Oh
yeah.
my god, and then, after you have pregnancy, it goes into your hips and your back, and so I can get all the torso, and just
Yes.
sculpt it
How beautiful.
in like a few hours through tiny incisions, like, I'm not removing
Yes.
skin, I'm not doing a whole tummy tuck, I'm not putting drains in. And then thighs,
Oh,
like
no drains
thighs.
at all?
No, no
Wow.
drains. You just put the garment on. You close the incisions and put the garment on, which is like a
Yes.
girdle. A
Yes. For
girdle.
compression.
Yeah,
Hmm.
compression
Hmm.
exactly, and contour. You want
Hmm.
to mold.
Yes.
So anyway, all these areas are really, really fun to contour. I've even done calves. I've done ankles,
Oh,
knees,
wow.
thighs, buttocks.
Yes.
And
And
then the buttock, you can take the fat and then you can wash it all down,
mhm.
and you can do fat transfer, right? For the
Oh.
Brazilian butt
Well,
lift.
that's funny that we
Yeah.
talk about Brazilian butt lift. I have a good story about that.
That's cute. I
So,
know.
so this morning, I'm like getting ready for work. And so I have a group of friends that I'll text, here and there, hi, good morning, how
So
are you?
sweet.
Yes, it's just, cheer me up text. So I text a couple of my girls and I'm like, hey, you guys want to, hear something funny? And there I sent him a video and I put a pair of pants on and they ripped, like,
Oh
literally
god.
on one cheek from straight up and down, and I was like, "What the heck was that?" And I'm like, so I'm looking at the mirror and I'm
That's a
like,
sign, right?
"Yes." I was like, so I
Not a good one. You're like,
no, it's not,
well,
and
maybe
so
it is. I don't know.
it was no.
You don't have to come to me for it.
Yes, I definitely, and I was like, "Look at this." I go, "My butt is growing." And I was so mad, but yeah, but oh my god, and the girls are like, "Only you." I'm like, "This is not good for me." So I
Yeah,
have to go scope.
that's right.
But so, Dr. Petty, how do you enjoy your time? Because you work so hard and,
Yeah. I
hours
like
of surgery.
nature. I don't get out like during the week at all.
Mhm.
Um, so on the weekends, my husband's a heart surgeon, so he also is very tied up. And I
Yes.
love the OR. It's
Mhm.
great to be in that. It's a very sacred room.
Yes.
Like nobody else can come in it. So
Yes.
there's a lot of good things about it. But still, on the weekend, it's nice to get out and get fresh
Mhm.
air. We love hiking.
You guys are both
I've jogged.
very
Yeah, I've been a jogger
yes.
for years.
Oh, nice.
And yeah, just like all the fresh air and just appreciate nature. And, we're lucky to live in Southern California. I
Yes.
grew up in the East Coast, so I'm so
Ooh.
happy to be here.
I love the East
Yeah.
Coast. What part?
Well, I was from Pittsburgh,
Mhm.
and then I spent a lot of time in the city, New York City, in the
Oh,
Bronx.
yeah, oh, the
And
Bronx.
yeah,
Mhm.
so I had relatives there, and then we went all over New Jersey,
And then you came to
typical
Los
shore.
Angeles. Look at
Yeah,
that, how beautiful.
I'm so lucky.
Yes. So did you start with your medical career on the East Coast?
Yeah, the East Coast. Then
Oh,
I was
okay.
in also,
Mhm,
so from Philly, Washington. I was at Georgetown,
mhm,
then Washington,
mhm,
Washington D.C., and then Philadelphia, and then
mhm,
I went to Chicago
mhm,
to the University of Chicago, and then I came out here,
mhm.
and for a while I was on the faculty at USC. That was kind
Oh,
of fun.
USC.
Did
Yes.
some research there. Work
Go
with the
USC.
residents. Yeah. Work with the residents. That was fun. That was
Mhm.
fun to get started like that. And it was
That's
exciting.
beautiful.
Yeah, to
Yes.
teach others. And then we moved down to the South Bay, and my husband's a heart surgeon. Then I decided to raise a family. I have two
Yes.
gorgeous
Beautiful
girls.
girls.
One is an environmentalist up in San Francisco,
Oh, beautiful.
and the other is here,
Yes.
a plastic surgery resident. So anyway, you kind of start raising your family. So
Yes.
you're I tried to make my life smaller
Mhm.
then because I didn't want to have messed up kids. So
Yes.
I tried to come home and be with the
Yes, be
children.
there and raise
Yeah.
them. But and it's amazing that you were able to raise a family and still work in surgeries and your
Yeah.
husband a heart surgeon. I mean, like,
Well, I
that's
had good help at home too,
yeah.
I have to say.
Mhm.
Like I had this great nanny,
Yes.
and she was young, she was in her late, I think, 30s,
Yes.
and so my daughters loved her,
Yes.
and so it was they bonded.
Oh, that's
I'd
beautiful.
come
Yeah, because
home and
it's hard to trust people nowadays.
they'd be
Oh.
watching Friends or something like that. So, I mean, it was really good. You have to surround yourself with stars.
Mhm.
So, in my office, I
Yes.
tried to have stars in
Yes.
the OR, with my
Yes.
help there, my
Yes.
nurses, my
Yes.
surgery
I
techs.
love Nancy and Roseanne.
Yeah,
They're
yeah.
great.
And
They're
then
great.
also, like, when you come home for
Yes.
your kids, yeah.
Yes. And it's an ease because you don't have that stress because you have such a great team and everyone's so welcoming. Everyone is just Like, I love your office.
Thank
Like,
you.
I was always so happy to go because everything was punctual. You have an
They really
appointment?
care.
They
I
do.
mean, and you want people to care. Like they say, you can't pay people to care.
No.
So you kind of, have to pick people
Yes.
and weed out,
Yes.
the ones
Yes.
that don't.
Yes.
Yeah.
I
You
agree with
guys
you.
deserve everything because you're coming in and you're paying cash.
Yes.
And to me, that means a lot
Yes.
because this is coming out of your pocket. And
Mhm.
I know, I don't come from any kind of money.
Mhm.
I grew up in a steel mill town. My parents didn't go to college. So, I know I worked for everything. And
Yes.
so I
You
know how hard
appreciate
people work
yes.
to be able to afford the surgery that I do. So
Yes.
we try to have an atmosphere that respects that.
Mhm. That's beautiful.
Yeah.
That's so beautiful. Well, I hope that a lot of people, reach out because I know for me, I was kind of lost, didn't know where to go with all this. And I was happy when I reached out to my friend and I asked her, and she was very happy and she was very pleased. So there's
Yeah. And
outlets
it's
for,
fun for me. I do get involved with social media. I do my
oh,
own social
yes.
media,
And you're
but
on, yes.
it's so hard to do that like, yourself. But
Yes.
again, I feel
You
like
do a great job, and
you do
you're
a fantastic. But I have to tell you, I am so happy when I see your face because I look and I'm like, oh my god, she
yes,
looks so. And then I'm like, and
right.
she doesn't have makeup on, and she looks so good. So I'm
Oh,
very
thank you,
proud.
thank you, I appreciate
Yeah,
it. I work hard. Sometimes I'm like, I'll be at home and I'll put a little bit of peels on here, and
it
I
looks so natural.
thank
Everything
you.
you do, you look very
I
natural.
have to
That's
preserve,
important.
preserve. We
Yeah.
don't use the O word or the A. No,
No O and A
no,
word.
no,
Nope.
no. But
We get better.
and yes, we
Yeah.
get better. We
And you
need
have a little help from a friend
yes, and
when
I'm
you
so
need it.
happy, and I know it makes me so happy. But, what other services do you render there at the office?
Well, we have a lot. I
Mhm.
mean, we do Botox, we
Yes,
do fillers.
yes,
So we do like Juvederm, Restylane, Radius. Those are all fillers that can be used again
yes,
to enhance
yes.
areas of the face that may be,
Mm.
devoid of volume. Then the facial skin drops, and you get jowls, and you get lines and folds, and all
Yes.
those
Oh, that's a
things.
good one. What do you
Yeah.
do for the jowls?
Well,
What do you recommend?
that's a loaded question. Well, one of the things, if you're young enough, if
Mhm,
you're younger, you can feel the face.
mhm.
So
Mm,
I have not had a
mm,
face or neck lift,
mhm.
and I've had my eyelids done, the
Yes,
brows.
yes,
But
mhm.
what can be done is
Yes,
as long as it's done well and
yes,
naturally,
yes.
you want to kind of keep the face volumized,
Mhm,
but
mhm.
not like so puffy that it looks so like a caricature.
Yes.
It doesn't look human.
No.
So, I mean, for the jowls, what
Mhm.
you want to do is fill the cheeks up, because
Okay.
it's dropping
Yes.
and it gets heavy here
Yes.
because you lose a lot of volume
Yes.
in
I
the.
feel like I'll probably need that in a couple of years. I'm like,
Yeah, and
mm,
you can tighten the skin. You can put filler because a
mhm,
lot of times the jowl, like
mhm.
you can kind of camouflage it because you get a little
Oh,
depression here.
yes.
You can put some filler along the jawline
Like,
and like help to
okay.
define the
There you
jawline.
go. That's a good
Yeah, there's a
because
lot of things.
I feel like those are the most common issues with women. The
Yeah.
jowls, the neck, the
Oh,
eyes.
definitely.
Yes. I think those are like the three, hugest problems for
Yeah.
us.
Well, they have done studies
Mhm.
actually. And so as I'm looking at you
Mhm.
right now, they've measured where the human eye looks at the face.
Mhm.
And what they found is it's like a triangle. So your eyes, actually this upper third of your face
Yes.
is super important
Mhm.
because we kind of look like this.
Oh, okay.
So, it's like an
Yes.
upside down triangle.
Mhm.
And so your eyes
Mhm.
are a focal point, right? And
Yes.
then of course, so like people are afraid to kind of augment the lips a lot of time. And I don't blame them because there's some pretty freaky looking lips out there.
Yes. Oh my goodness.
So, when they come in for like lip
Mhm.
injections, I try to talk to them, and if they're shying away, I don't want to convince anybody.
Yes.
But if I doing them for the first time,
Mhm.
I try to tell them, look, it's going to look over augmented. Plus, when you give the lip injection,
Mhm.
it has local anesthetic in it, so it kind of makes your lips feel big,
Big.
even though they're
Yes.
like not really
Oh my
big, but it
goodness.
makes them feel big because they're numb. And so again, I give the patient the
Mhm.
mirror.
Yes.
So what I do is as I'm doing
Mhm.
it, I say, look, and then I'll kind of build the column and build the Cupid's bow.
Yes.
And then they're flat on the other side. And so they kind of say,
So they
oh,
see
it looks
results right
pretty good.
away.
Yeah.
Yes.
But you don't like just kind of inject and then go,
Mm-mm.
here, look
Mm.
at it. You just
Yes.
kind of show them
Show
and
them.
you're kind of building
Mhm.
and creating and then,
It's like art.
yeah,
Yeah.
and then you're also, getting their confidence
Mhm.
as you do it.
Yes. Yes, the lips are
I love lips.
oh
I
my
do
goodness.
love lips. You have
And
gorgeous lips.
thank you.
Yeah, you
I
do.
feel like they're just a little too big, but
Oh, they're beautiful.
thank
Well, you
you.
know what? You have your face
Mhm.
is wide, so it's good. You can take that.
Yes.
But that on my
Sometimes,
face
yeah.
wouldn't look good.
No.
No, it looks really good.
Thank you. I appreciate it. Because sometimes I'm like, oh my God, especially when I smile, I'm like, ah. I'm like,
No, they're beautiful.
ah. Thank you. I do appreciate it. But so Dr. Petty, what are your hours and where are you located?
Well, I'm
Mhm.
located in Torrance, and I am on Hawthorne Boulevard.
Mhm.
We're between Sky Park and Lomita.
Mhm.
I've been in the South Bay since 1990,
Mhm.
so I love it here. And my office is single level. There's
Yes.
plenty of parking. It's a beautiful open air office with lots of
It's a
skylights, and
beautiful office.
yeah,
Now,
it's
didn't you
very
just
welcoming.
win an award?
Oh, yes. So
Yes.
thank you for mentioning that.
Yes.
Yeah. Yeah, I won the Newsweek award.
Mhm.
I was one of the best plastic surgeons in the
Yay.
United
Wait.
States.
Oh, okay.
And then
Who's
I
that?
also have the Daily Breeze.
Thank you
Thank you.
so much.
The Daily Breeze
Mhm.
runs a reader's
Mhm.
poll.
Mhm.
And so for the last 10 years,
Yes.
I've won best cosmetic surgeon. And then the last 2 years, they also added another category of best plastic surgeon. And so
Wow.
I won both. And then I
Wow.
had like a separate spa. I
Yes.
moved to a new location, but in my old location, I had a separate Spa Bella.
Yes.
And so that spa
Mhm.
won also best medical spa in the South Bay.
Wow.
Now,
Mhm.
I have kind of like now I don't have a lot of nurses
Mhm.
working with me that do injections. I do everything myself because
That's
I'm at the point in my
beautiful.
career where I honestly don't want to be in charge of
Mhm.
anyone. I just want to be in charge of myself.
Yes.
And then I have wonderful people helping me,
Yes.
but I'm not really overseeing anybody else
Mhm.
except my own work.
Correct.
So I am Spa Bella,
Mhm.
you know.
That's and I could honestly tell you that I appreciate when a doctor can take the time to do
Yes.
the action instead of a nurse. I mean, there's nothing wrong with the nurse doing the job, but when you're going to a doctor, it's nice. It's just that little special, even if it's Botox, it's beautiful that the doctor's administering this
Well,
into you.
there's something for everybody.
Yes.
And so some patients will only go to a doctor.
Mhm.
Others will go to nurses. I've
Mhm.
had nurses
Yes,
inject me. So I mean,
absolutely.
I
Yes.
trust that they're very, very
But
good.
there's just something
But
special when it's a
but I
doctor.
think like why I do it because a lot of the other plastic
Mhm.
surgeons are like they don't do injections. And I'm thinking, well, I mean, if you bought a beautiful gown, right?
Yes.
And then wouldn't you want to put on the earrings, right?
Mhm.
And then the bracelet, and
Correct.
then the shoes and
Yes.
the purse,
Yes.
you'd want to have all that. So
Mhm.
you may come to me and I may do your eyes, but
Mhm.
then I kind of look at you and I'm thinking, hmm. So
Mhm.
there's other things that we can do that are non-surgical that are going to enhance
Yes.
the eyelid, the results of your eyelid surgery. So definitely I can add that, and I can do those myself. So 100%, in
Yes.
control.
Yes.
And I think the patients love that.
I love it personally too. That's why I was so comfortable there because you're very hands-on.
Yes.
Very
Oh,
hands-on.
very.
Yes. And
Yeah.
you
And
have
I'm not like running from room to room to room to room to room.
no.
Yeah, I take my
You
time.
do
So when
take
I
your
do the
time.
injections,
Mhm.
like I massage and I mold and it's not like some of the med spas where you push through
Yes.
and it's about the money.
Yes, and that's one thing that I love about you. Well, our time has
Yes.
ended. And
It's so natural talking to
it
you. It's so
is.
much
It's
fun.
so
Thank you
good.
for
And
inviting me.
of course, are
It's a
you kidding?
pleasure.
It was I was so happy when I was able to be to bring you in because I'm just like, I love you. I do love
Thank you so
you. You're the
much.
best.
Thank you so much.
Thank you. And so we're going to end this. You guys, thank you so much for watching. If you have any questions, you are more than happy to reach out to Dr. Christine Petti's office. And you guys, thank you so much. Have a great night. Bye.
Thank you. Happy holidays.
Happy holidays. That's all for today. Thank you for watching and listening. It truly means the world to me. If you enjoy the show, make sure that you like, share, and subscribe at Let Loose with Lou on Instagram, YouTube, and Spotify.